Hey there, it's Dr. Alan Bauman from Bauman Medical, and we're here in Chicago at Boston BioLife, and I'm here with the founder and director of the program, Joe Krieger, who started Boston BioLife how many years ago?
It's actually 3 years to this, kind of around September. Our first meeting was in November, but we put the serious preparation into the Boston BioLife meeting at the American Academy of Physical Medicine and Rehabilitation.
And so what's the whole point of this? Why are we here? What are we doing?
So basically we're teaching physicians the biochemistry of medicine, and one of the corollaries for translational medicine is to bring scientists, technology providers, and healthcare providers together in one room. So that's what they call translational medicine. They say it's bench to bedside, but it's really bringing the innovations of medical technology together with the innovations of life sciences. So as medicine has evolved and things have become less and less invasive, so open surgeries have become minimally invasive surgeries, things are done percutaneous now. Instead of open heart surgery, you can do things through portals, etc. And it's really no different in the next iteration, in that incisions are getting smaller, technologies are getting better, but now we're actually healing the body on a cellular level.
Oh yeah, telling the body to heal itself. And so regenerative medicine, that's what it's really all about, right? So whether we're doing something aesthetic for hair or something for pain or whatever, there's so many different applications.
We've got sexual dysfunction, we've got aesthetics, we've got hair loss, we've got interventional pain management, we've got orthopedics, orthobiologics. So really every tissue type in the body has the ability to regrow or regenerate. What I think is beneficial for you being here, and it's also beneficial.
Yeah, why should we be here?
Well, because you're going to get a full spectrum exposure to all the biologics. Right? This isn't a one size fits all. It's not a panacea.
Right.
We've got the biochemistry of blood. You've got adipose-derived biologics. You've got bone marrow aspirate. You've got perinatal biologics, which are coming out of a bottle. But they all fundamentally have similar characteristics. They're cells, signals, and scaffolds.
Yeah.
That's the trilogy. That's the mirepoix, if you will, of regenerative medicine. You need those three constituents. So as cells signal other cells to behave in certain ways, and DNA is upregulated through the transcription of RNA, things regrow. Right? So when we're little, or babies, or embryos, we have every gene. But as we become more specialized or committed, those genes get turned off. So as we age, we rust. We carboxymethylate our DNA, right? We have oxidative stress, and our systems change. So in order to, detect, deter, defeat, right? We have to start turning these genes back on and trying to there's two constituents. One's to turn it back on, and the other one's to maintain some type of homeostasis. Right? That's the balance.
So that's what we're learning here. I mean, I've sat in on so many different lectures and seen so many new, interesting ways to kind of affect the body, whether it be for all the different things that you've mentioned, aesthetics or pain, ED, you name it. So it's a really incredible conference. Why should people come to this conference? Who should come and why?
Well, I think anybody healthcare practitioner that's interested in the future of medicine, that wants to provide the best care for their patients, but also be on the leading edge. What we learned today and what we've learned in 3 years, this is our 20th course. I think we've had 1,500 people come through this.
Wow, great.
And we've had people come 5 times. We've had people come from all over the world. So as we expand our footprint and we communicate with the physician community, what happens is they learn from each other. So one of the essence of this is teachable medicine. So not only learning what works, but learning what doesn't work. So as clinicians begin to become more connected, because we've never been more connected as a society than we are right now. And in 2 hours from now, we'll be even more connected.
Absolutely.
But the point being is people now have the ability to communicate with each other. Patients are actually more educated. Social media has driven awareness, especially for all these novel technologies.
Absolutely.
So patients are going to start educating their doctors. The problem with...
Yeah, they're going to start to demand these kinds of treatments and procedures because they don't want old school pharmacologic interventions or invasive surgical procedures.
Remember, 20 years ago, there was WebMD. Right? Now everybody's got a computer in their hands.
That's right.
And everybody can search. But yeah, you have to be buyer beware, and you have to be, aware of what's happening. But really with minimal education and minimal difficulty, you can figure out what the next thing is.
Right. So to wrap up, how would you summarize this meeting? I know we're coming to the end of it, and what do you see for the future? What's your plan for the next few?
So we started off with pain management, interventional pain management. We started off with low back pain, degenerative disc disease. Then we went to the full spectrum orthobiologics, including spine. Now we've bolted on functional integrative wellness, and now we're melding that with what's called personalized precision medicine. So the N of 1 care plan dictates that every patient is their own clinical trial. So when you say, I am N of 1, this is a campaign, this is my biology. So having the ability to look at our unique situations and then tailor therapies to that. So really the mission is to keep bringing the technology providers together, to bridge the gap between science and medicine, and to give the resources to the attendees, the healthcare providers, and the faculty, and the technology providers, so that their vision can be to evolve. Even since we've started this meeting 3 years ago when we only had 5 vendors, now it's 30 vendors, all of these companies have developed new technologies. All of our faculty have created new presentations. People are publishing as groups. There's studies and journals, and things are happening. So to answer your question, I believe we'll do one more of these by the end of the year, November, late November, early December, if the people want. And then next year it will be between 4 and 6. But we also have an online academy where all of our presentations are archived. We're doing webinars, live webinars, and canned presentations so that people can go back and learn in their own
Great.
capacity.
So where can somebody go to check out that library of information?
So bostonbiolife.com is our principal webpage with information on our faculty, vendors, and our courses. But Boston BioLife Academy will be going live literally when we get home.
Great. Well, congratulations. Really a great meeting. It was great to be not only an exhibitor but also an attendee. I really enjoyed it. My staff enjoyed it, and we've gotten such great feedback from everybody who's been here. So congratulations.
Well,
good
thank you
job.
for taking
Upward
the
and
lead.
onward. Hey, Joe. No, this has been
Since
great.
we met at the World Stem Cell Summit, we've done a lot of things, and
That's
now we've
right.
got the ability to create stem cells biologics for the clinical application of hair restoration.
Exactly.
Not just using PRP, not just using...
Yeah, don't let the cat out of the bag yet.
Don't let the cat out of the bag, but
Okay.
there's new things coming, so thank you very much for having me.
All right, you're welcome.
All right, I got to kick this ball off.
All right.